Now we will go to the next very prestigious AIOS endowment lecture, which is named after Dr. S.S. Badrinath sir. We all know that Dr. S.S. Badrinath sir was a visionary leader, Indian ophthalmologist, and founder of globally renowned Shankar Nethralaya Center of Excellence. After his training in the US, he came back to India to start world-class retinal care and is often called as the father of retinal disorders and retina surgery in the country. He has trained generations of ophthalmologists and truly transformed the eye care in our country and beyond. So this year, we are honored to bestow AIOS Dr. S.S. Badrinath Endowment Lecture on Dr. Kim Ramasamy sir, who is the Chief Medical Officer and Director of Information Technology at the prestigious Arvind Eye Hospital and Postgraduate Institute of Ophthalmology at Madurai. Thank you, sir.
Thank you, and good morning to all. It's a great honor to give this talk today in the name of Dr. S.S. Badrinath sir, a pioneer in eye care. Through Shankar Nethralaya, he has transformed eye care and introduced innovations that still help us today. His work continues to inspire many of us as we face new challenges in managing eye care. And I really take this opportunity to thank the organizers, the scientific committee of AIOS, for giving me this honor to deliver this very prestigious lecture. I chose to speak on this topic for two reasons. One, it is the most important challenge, not only for the retina specialists in the country, but every ophthalmologist in India, and it is not, it is a problem. I've also spent a lot of time, almost 30 years, in this particular specific condition. Now, with the prevalence of 537 million globally, and which is expected to increase to 643 million by 2030, it's really a cause for concern. If you look at the prevalence of diabetes in our country over the last 6 decades, you can see the tremendous increase that has happened from 1975 or 65 to 2024, which shows that the country is entirely, not only in the urban population, but it is equally increasing in the rural population. Today, we have not just 71, which was thought of earlier, we have 101 million diabetics in India. What that means for ophthalmologists is that we are going to face a lot of this diabetes-related complications. So for the last few years, many of us got together under the Ornate India label, where we did a multicentric diabetic retinopathy prevalence study in 20 centers across 20 states, where we found the overall prevalence of diabetic retinopathy among the diabetics was about 12.5%, with a vision-threatening diabetic retinopathy of 4%, which is like anywhere more than, little more than 300,000 patients are already with this condition. The SN Dreams had projected that this will happen in 2030, but unfortunately we are there in 2024 itself. This number has been crossed. So what does that mean? A study done in 2020 when the prevalence was thought to be 55.9 million. Can you imagine the cost, the annual cost of total screening is 4,000 crores. And if you add another 20% of them getting treated, it's another 300 crores is the annual cost on this. So what is the economic impact of this vision loss? There's going to be caregiver burden because the productivity lost by these carers and the reduced productivity of the visually impaired, and of course a huge sum of 47,000 crores in the total lost productivity. So what are the barriers today? Because there are cost barriers because of the expensive equipments, very poor awareness, and of course access challenges, especially in countries like where we have huge divide between the rural and the urban, and more importantly, the limited resources, that is shortage of specialists in the country, with a resource crunch of heavily, with just 1,700 retina specialists, and with the huge 101 million diabetics. So who's going to be responsible for this huge number of patients that are going to come up with complications? So what should be done? We have to improve awareness among all the stakeholders. And screening of diabetic retinopathy today is limited to the ophthalmologist. I keep saying that repeatedly in every forum, that the onus of finding diabetic retinopathy should be with the physicians, because they are the ones who are seeing the target population. And today, technology is making all the help in identifying these patients. And another important thing is to improve primary care for diabetes so that we can reduce the advanced diabetic retinopathy changes that are happening over time. Recently, the AIOS and the Vitreoretinal Society of India joined together had published the screening guidelines for diabetic retinopathy. In our own experience, we've been doing a lot of outreach screening in the community. And we said if we can screen 100 diabetics, only 20% of these diabetics will have any retinopathy at any time. This is seen repeatedly in all our screening programs. Of these, only 20% may have any sight-threatening condition. But since we do not know which of these, we'll have to examine every single diabetic that is out there and should be done at every opportunity possible. For the last 2 decades, almost 20 years, more than 20 years, we've been doing this telescreening for diabetic retinopathy by putting fundus cameras in the diabetic clinics, training the technicians to take photographs, sending it to our reading center where a retina specialist would look at these images, generate a report, and send it back with a turnaround time of about an hour or 2. Now, with the recent advent of using AI, artificial intelligence tools, we have been able to become independent of ophthalmologists. The physician clinics where we have put our fundus cameras is independent of any ophthalmologist grading these images. The person is getting the report within less than a minute. And what's more important is it is available 24/7 and with all the consistency which doesn't happen with different ophthalmologists grading these images. So we have been using this in our primary eye care centers where the technicians, trained ophthalmic technicians, are screening patients for eye conditions in rural areas. In those places, we just saw before deployment of AI versus after deployment of AI, the identification of diabetic retinopathy cases went up by 8 times. We also did this in our physician clinics. So in these 2 use cases, we have been using AI for the last 5 years. We have screened almost 1 million eyes in the last 5 years using AI. But what is interesting to see is the prevalence of diabetic retinopathy is more, almost 3 times in the diabetic clinics, because obviously here you're using the target population to screen them, because every patient you're screening is a diabetic, and this gives you a much better yield. And I keep saying that's one reason why we have to insist that all our diabetic colleagues, all the physicians who are seeing the diabetic patient should be doing the screening and not just the ophthalmologist today, because telescreening has made it all the much possible. Last year, again, from the VRSI and the RSSDI, which is the largest diabetologist association of India, jointly together published this screening guidelines for diabetic retinopathy for the physicians. And we are running projects to see how we can engage every physician in the country to do this screening, which will be a huge value addition for their patients. Today, it is not done. If every diabetologist or a primary care physician could screen their diabetic patients just using the simple fundus camera, we would be identifying much more patients. If you look at in the West, in the last 10 years, there's a huge drop in the vision-threatening conditions and diabetic macular edema. This is declined probably due to the improved diabetes management, early detection through regular screenings, and of course advances in treatment options. Singapore has waged a war on diabetes using different strategies. Let's beat diabetes, regulation on sugary beverages, and many other programs, which really is the need of the hour in countries like ours. So the onus, as I said, should be with the physicians. AI today enables screening without the ophthalmologist dependency. So how do every one of us make our physician colleagues to take up this responsibility? As ophthalmologists, we have to create awareness in all opportunities possible. Ensure every diabetic that is walking to you has a retinal evaluation. And not only that, as I said, managing the current vision-threatening diabetic retinopathy itself is a challenge for all the retina specialists. So every ophthalmologist should be knowledgeable or gain knowledge in managing the primary management of diabetic retinopathy. So in conclusion, early identification of diabetic retinopathy is a must, and we have to integrate screening in our routine healthcare programs, especially in corporates where we have sedentary workers. And strengthening primary care and preventing diabetes is the need of the hour. So we have to work together to prevent this huge economic problem, not only economic, but the health problem that is going to come up with the prevalence of diabetes increasing year on year. Once again, I thank the organizers for giving me this honor of delivering the prestigious Dr. S.S. Badrinath sir's endowment lecture. Thank you.